If you've been feeling tightness or pain on the back side of your hips right here, I'm gonna show you one of the things that we're looking for as a chiropractor and how by doing an adjustment, you can create an immediate change within your pelvis and that tension that you're feeling in your back. So I was talking with Kelly a little bit ago, and Kelly, would you mind pointing to where you're feeling some pain? So she's feeling pain right on this spot. So this spot that she's talking about, on that bony spot right there, is the S-I joint. So it's the back part of your pelvis, that side hip bone. And so this hip bone needs to move up and down as you're walking, as you're squatting, as you're moving about. And so sometimes this can get stuck. It can get misaligned and restricted. And when it's restricted, it's gonna cause all these different muscles to tighten. So one of the things that we're looking for is how that joint is moving. I wanna show you on my spine here real quick. So the main parts I'm feeling for are these two SI joints and how these are moving forward. So we're gonna see on Kelly how it's moving and then do an adjustment if we feel like it's necessary. So if I put my thumbs right on those two bony spots here, I'm gonna hold that spot and I'm gonna have Kelly bend forward slowly, right there. And so you can see that right side continues to ride up, coming back. Let's do that one more time, right, going forwards and riding up. So that spot keeps going forwards. Ideally, this would stay put and just her spine would bend forward. So we're already thinking that that right SI joint is getting locked up. Let's see you going face down. So as she's face down on the table, we'll be able to see through different ranges of motion as well as palpation how that joint is moving. Just by a general sweep of the spine, looking to see if there's any tenderness, any tightness within those muscles in her lumbars. On her, that feels really good. If I isolate those joints again, I can put my thumbs right on those bony spots and I'll have you bend your legs. Okay, as she bends her legs, you can see how my thumb rides up and the left side again stays nice and put where it was. Yep, and back down. Now I want you to keep your legs straight and I'll have you lift your right leg as high as you can. Okay, that's really good range of motion. That's checking out the sacrum, or that tailbone in the middle, and then the left side. Yeah, and that moves really well too. So her sacrum is moving really well. Checking leg length, this is one of the indicators we use for seeing if there's any discrepancy in her hips. And so just by evening out her legs here, you can see based on her shoes, how her right leg is quite a bit shorter. So it's shorter there, and then as we bend it, so functionally looking, here you can see how they even out. So her legs are going even as we use it through its function, but just here it's shorter. So I'm thinking she has a functional short leg due to a misalignment or rotation in her hip this way. So what we're gonna do is adjust this part of her pelvis. So I'm gonna get you on your side facing that way. So this is one of the simple ways we can adjust the pelvis and make an immediate change. So as I put her body in a nice comfortable position, keeping her spine nice and straight, there's no twisting of her spine. I'm gonna isolate that specific spot that we were talking about. And as I find that SI joint right there, I'm gonna roll her over and adjust. Cool, so that moved really well. Let's get you face down one more time. And then seeing exactly how those are moving again, I'll have you bend your legs. Nice, and so now it's nice and even. Let's get you sitting back up. So checking how this SI joint is moving. So people who have pain in that spot, pain going down to the side of their hips and glutes, pain that wraps around to the front, this is an extremely easy adjustment when done properly for how we can create an immediate change. So now let's see how this is moving as you bend forward. Yeah, so now those are exactly the same. Cool, so that is one of the things that we can do as chiropractors to relieve a lot of that tension in the back side of your hip, into the front side of your hip, and going up your back this way. And for all of you who have been experiencing this, I want you to know that you don't need to suffer needlessly, that there are options such as chiropractic care that we can create change almost immediately. And so if you're in the Oakland area, if you're interested in chiropractic care, you can set up an appointment with me by clicking one of those buttons at the top of my page. You can always message me or find us here at the Source Chiropractic in Oakland. I love and appreciate you. If you know anybody else who's been suffering with this type of pain or tension in their low back, please tag them in this video. And what we're here to do is really to ultimately help more people within our community so that they can be better versions of themselves. So I look forward to seeing you soon, and please let me know if you have any questions.